My name is John. I am a husband, father, son, colleague, and friend, and not too long ago, I thought all that was about to come to an end. I've been playing hockey with a bunch of guys for years. Just last year, my son joined the team. He makes fun of us old guys, but I know he really enjoys it because we're able to play together. This one time, I was heading down the ice, my big breakaway move, when I felt this sharp pain in my chest. It's hard to explain how it felt. It was like a concrete block had been dropped on me. I felt like the world went into slow motion. I heard my buddies shouting at me from what felt like a long way away, and remember thinking how cold the ice felt against my face. And then my son was there, and I could hear the panic in his voice. In that moment came an overpowering sense of regret and sadness to be leaving him so soon. I wanted to tell him I'm sorry for all the mistakes I've made as his dad, but I couldn't make a sound. I have a fleeting memory of a siren. I heard someone say defibrillator as the paramedics rushed me to Capitol Health's emergency department. I woke up very slowly. There were bright lights over my head and a mask over my nose and mouth as someone checked my breathing. The nurse was checking patches on my chest and IVs in my arm. A doctor said my name and asked if I could hear him. I remember his voice because he introduced himself. He was kind and made me feel safer. I knew that I was being looked after. My wife arrived at the emergency department and she and my son were with me in the room. We didn't know it at the time, but dozens of people at Capitol Health were already involved in my care, working to save my life. As I arrived in emergency, my medical records were checked and information about my condition was added. Blood was taken, an EKG was run, and a heart cath was scheduled. My wife told me that there was a lot of activity around me that night, but everyone was so kind and professional that she felt confident. I needed a procedure to open up the arteries around my heart because the EKG and my lab results confirmed that the massive pain in my chest was a heart attack. The cardiologist explained the procedure to me as my wife held my hand. She said that if necessary, stents would be put in the arteries in my heart. She told us that if the procedures weren't successful, I would need open heart surgery, maybe immediately. A heart attack? But I'm a healthy, active guy. Open heart surgery? I struggled to believe it was really happening. I thought, my family depends on me, and I just can't leave them now. There's so much left to do. The thought of surgery terrified me. It terrified us. The staff could see my fear, and everyone responded with encouragement. Just before they took me in, my wife kissed my forehead and whispered, "You're in good hands." I could see it in her face, that she really believed, and that made me believe it too. I don't remember the procedure, but it was a relief to hear the cardiologist telling my wife that I received stents. It had gone well, and it didn't sound like I would need to have surgery. I was so grateful that the staff had the expertise to effectively treat me in the least invasive way possible. I can't tell you how much better that made me feel. In my room, my nurse connected me to a monitor and helped me get comfortable. She introduced herself and talked to my wife and me about everything she was doing, from adjusting my bed to lowering the lights and answering our questions about all the beeps and bells we were hearing. I remember being cold and really appreciated the extra blanket that was brought to me that night. It was late when my son came in. It was so wonderful to see him. My nurse sat with us for a few moments and helped us develop a plan so that my family could be present when they needed to be there. I spent most of the next day sleeping. I had never been so tired. A man came in my room, introduced himself, and then checked my breathing and my oxygen levels. I didn't remember, but he explained that he had already seen me when I came into emergency. Later that day, the physiotherapist came in and helped me get up and moving. They said it was an important part of my recovery. It wasn't easy, but they encouraged me and I was able to walk one full lap of the unit. That evening, a doctor who works with cardiac patients came in to see me. We talked about what would be happening over the next few days, and he answered some questions that had come up. And then he told me it was very likely that I had diabetes. Additional tests show that it was true. I couldn't help but feel frustrated throughout all of this, but the staff sensed how I felt. They answered my questions, and we began putting a plan in place to deal with this change in my life. So many people made a difference during my stay in the hospital, like the porters who took me for tests and asked me every day how my day was going. These simple acts of kindness made me feel so much better. It reassured me that I was in a very caring place. The days feel long when you are in the hospital. It made me smile when the housekeeping staff would come in. They were so friendly and kept everything tidy, mopping the floors and wiping down the tables so everything felt fresh and clean. I was surprised to find I had so many meal choices which were very good and good for me. One night I was craving ice cream and mentioned it to my nurse, and before I knew it, I had a low-fat, no-sugar-added ice cream. It was great. I appreciated her thoughtfulness, and I also appreciated the people at Capital Health who hunt down and purchase supplies, including these healthy, wonderful treats. When you're in the hospital, little things mean a lot. The man in the cafeteria who always asked my son how he was. The parking attendant who helped my wife when she lost her ticket. And the volunteer who helped visitors find my room. As a patient, I never met these people, but they too were a part of my healing. Above all, I'm grateful that my family was welcomed throughout my time at the hospital. They were included in discussions with my caregivers, and I'm thankful they were there with me every step of the way. And here's the amazing thing. The caring continued after I was discharged. I was referred to the Diabetes Management Center and learned how to control my condition, and then met with my family doctor who helped develop a plan to lower my risk for another heart attack. I took some wellness classes with the community health team located just down the road from my house. And now my wife and I are enrolled in a program to help people deal with stress. Today, I'm 25 pounds lighter, I'm controlling my diabetes, and my risk of heart disease is reduced. I'm living a full and healthy life and taking good care of myself so I'm there for my family. I am so thankful for all the staff and professionals who contributed to my healing at Capital Health. I'll never forget the commitment and caring that all these people bring to their jobs each day. Whether they were directly involved in my care or working in a supportive role, they had an impact on my experience. They consistently give their best and put their patients and their families at the center of everything they do. It really comes from the heart when I say to each and every one of you, thank you.